I want to talk to you today about the primary care situation we found. Oh, thank you. In the lower Northeast. We investigated this area, as you heard, because of the long waits at Health Center 10. In fact, the zip code we're in right now, in addition to what we know about those waits, this zip code right here has about 23,000 people who have a chronic disease like diabetes, high blood pressure, asthma, and not nearly enough providers who accept Medicaid. But before I go into more details on what we discovered, I want to start with a map of Philadelphia to get everyone oriented, and then talk a little bit about primary care and why it's important. So, as you can see, this is a map of Philadelphia, and you can see, so Center City right here, this is the Schuylkill River, the Delaware River, and this here is Roosevelt Boulevard. We're right here under that little hump on Roosevelt Boulevard. This here is Frankfurt Avenue, and I believe Frankfurt Hospital is right around here, and then up here we have Cottman Avenue and Health Center 10. So we looked at this area in the blue oval, which is home to a quarter of the city's population, but it has only 4 community health centers, including Health Center 10. So to talk a bit more about what primary care is, we really assumed that there probably weren't enough primary care providers in the catchment area for Health Center 10 because of the long waits. And primary care is the health care that people get from doctors, nurse practitioners, physician assistants who treat a large majority of personal health care needs. It usually happens in a clinic or a doctor's office. And we're not talking here about the section of healthcare that deals with hospitalization or specialty care, so really primary care, doctor's office, common complaints. And primary care providers play a very important role in detecting and treating common and chronic diseases like asthma, diabetes, and high blood pressure. It's important to treat those conditions because if we don't, patients can have very serious long-term consequences, all the way to death, obviously, but stroke, kidney failure, heart attack, among many other things. So now that you know which part of the city I'm talking about and what subject we really wanted to address, I'll explain the questions we asked to sort out this problem of long waits for primary care. We asked, where do most people live who need care the most? How many providers are there? And which patients do those providers see? And how long does it take to get in to see them? To get to the number of people who need primary care the most, we estimated the number of residents in this area at high risk of not seeing a doctor for important primary care services. We did this by counting the people who had at least 3 of those 4 conditions: less than a high school education, low income, no insurance, or no usual source of care. Having any 3 of these 4 puts you at high risk of not getting to see a doctor in a given year. And you can see from this map that the largest numbers of residents at high risk are in the dark blue, in 19120 and 124, where we are now. If you take those 2 zip codes plus 19111, there are 10,000, in those 3 zip codes, 10,000 residents who are at high risk of not getting to see a doctor in a given year. Just to remind you of the location of the health centers, you can see community health centers on this map. The stars represent the city's health centers. These are only the ones that have overlapping catchment areas, so who might see some patients within this Northeast region. So these stars are city health centers, and then the yellow triangles here are private nonprofit federally qualified health centers that also see patients regardless of ability to pay. And it does, as you can see, there are a number of them that might see patients in this area, but clearly based on the wait times, they can't possibly be meeting all the need that's out there. We also used a different way to measure the number of people who would need more primary care services. On this map, the dark blue shading represents the highest number of people with a chronic disease. So high blood pressure, heart disease, asthma, high cholesterol, diabetes, people with these conditions who do need more primary care services. The 3 zip codes in darkest blue, again, 19111, 120, and 124, add up to 72,000 people with at least one chronic disease. The primary care practices we found in the area on this map are shown as flags, with each flag representing one practice. And then the circles in light green represent what you saw on the previous map, the number of people who are at high risk of not getting to see a doctor. So the circles in 19120 and 124 each represent about 4,000 people. As you can see from this map, those 3 southwestern zip codes, 19111, 20, and 24, combine both high rates of chronic disease and a high risk of unmet need. That's why we need to focus on these 3 zip codes. Moving on to assessing the other piece of the puzzle, we had to count primary care providers in the catchment area. You'll notice that our provider database, here, which is shown here in the slightly gray zip codes, doesn't include 19154, which as in the original catchment area for Health Center 10 wasn't included, and that's why we didn't include that zip code in the provider survey. But so in this area, we found 300 providers working in 186 practices. That includes providers who are working in community health centers like Health Center 10 and the other nonprofit health centers. And this number of providers represents one provider for every 1,163 people. That sounds like a lot of patients per provider, but in fact it's pretty close to the national average, and the federal government defines a shortage area as more than 3,500 patients per provider. So clearly, from a pure numbers standpoint, we don't really have a shortage of providers in this area. To explore this, we did a couple of telephone surveys, and we got the most information from our shortest survey, which asked only 2 questions. Do you accept Keystone Mercy Health Plan? And when is your next available new patient appointment? We found that nearly 40% of the 300 providers in this area work in practices that are not accepting those patients who have Keystone Mercy. And we asked about Keystone Mercy because it's the largest Medicaid health plan in the area. Importantly, providers who accept Medicaid plans are concentrated in only 14% of the practices, so about 26 practices, which include the health centers. And the health centers actually are pretty large practices compared to other practices in this area. So if you live in this area and you have Medicaid and you can't access a health center, the number of other practices that might be willing to see you are quite limited. We also found that wait times range from same-day availability in some private practices to between 39 and 74 days in the health centers. In our longer survey, we asked providers questions about how many patients they see in a year, what types of insurance they accept, and other questions about the kinds of patients that they see. And overall, providers didn't share answers to these questions very willingly. Sometimes they just didn't know the answer because it's hard to measure a panel of patients. And sometimes they just didn't feel comfortable sharing it. If I say I take patients regardless of ability to pay, does that mean they're going to be beating down the door, next week? On the other hand, providers were quite willing to talk about their own language capacity and the language diversity of their patients, which is what you see on this slide here. As you can see from this graph, there's a wide diversity of languages spoken by patients and providers, and there's pretty good overlap. Unfortunately, despite this overlap, there are still some languages that fall on either side, and most practices did not have access to interpreter services. And although patients are by law entitled to services in their own language, often the resources just aren't there. As you can imagine, it's very important to be able to communicate clearly with your provider, and if there's a language barrier, that's really a problem. We know that many people have moved into the lower Northeast, and this population has changed a lot in the last 10 years, with many people immigrating from other countries as well as migrating within the city. And the number of health centers available to these people just isn't enough. So to summarize, We have roughly 10,000 people in these three zip codes who aren't getting to see a doctor every year. In an area where chronic disease takes a heavy toll, 72,000 people with at least one chronic disease, and few practices that will see them. This area of the near Northeast needs primary care providers who will serve low-income families. Our recommendation is that a safety net practice, a community health center, be developed in this area in collaboration with community groups and public service organizations. The health reforms that were passed in 2010 did offer increased funding for community health centers, including a planning grant for a health center in the area. And these health reforms will also increase the number of Philadelphia residents covered by Medicaid in 2014. So we need to be able to plan for their access to primary care in addition to the needs that exist right now. We need to act now for the current population and also plan for the future. As I mentioned, there's a planning grant that's going to explore health center development in this area, and we hope that community members and groups will come together to move this along, because any community health center really needs community participation in order to be successful.